Hi, good evening, and welcome to the Transition of Care webinar. My name is Dr. Hope O'Brien, and I'm a neurologist and headache specialist based out of Cincinnati, Ohio. I'm the CEO and medical director for the Headache Center of Hope, and I see patients of all ages, pediatric all the way through adult. So prior to running my own practice, I was an associate professor at the University of Cincinnati, as well as Cincinnati Children's Hospital. So there I did a lot of work on young adults, adolescents with migraine, and ran their young adult program, which was developed to really target those patients who were in that late adolescence and young adult phase in life, and then help with their transition into adult care. My clinic was a multidisciplinary clinic where we had me as the headache specialist. I had a psychologist who focused on pain management for migraine care, as well as a nurse practitioner and nurse who specialized in headache education. So I'm going to begin this webinar with some information, some facts about migraine, and then we'll talk a little bit more about transition of care and how to really prepare your child or your young adult to go and transition into adult care for migraine. So as we know, migraine is a common condition that affects children, and it may continue into adulthood. More than 6% of adolescents are affected by recurrent headache. 8% are diagnosed with chronic daily headache, and 46% of patients will have migraines persist, with 20% developing transformed or a more chronic persistent headache pattern. Aggressive and successful treatment can lead to migraine remission in up to 34% of adolescents. Transition from pediatric to adult care has become an increasingly popular topic, but surprisingly, the process of transition of care is not formally standardized. Each facility is left to decide when or whether a patient is ready to transition, along with how much guidance the patient will receive during the process. Without guidance, successful transition is less likely. In discussing transition of care, I like to break things down into 3 phases. Number 1, transition planning. Number 2, patient education. And number 3, transfer readiness. Transition planning is the goal to expand the patient's personal knowledge of their condition and introduce skills for self-advocacy. It's a time to figure out what is important for both the patient and accepting provider to know prior to the transfer. Patients should be introduced to the concept of self-management. What do I mean by that? It's ensuring the patient has an understanding of the type of headache disorder or diagnosis. It's important that they understand how to abort and prevent their headache, and that prevention also consists of healthy habits in the form of lifestyle modification, biobehavioral approaches, including cognitive behavioral therapy, biofeedback, and pharmacological management. The patient starts to take ownership of self-care and feel confident in the ability to make informed decisions. Patients should be addressed directly and clearly spoken to instead of focusing on addressing the caregivers. By doing this, the clinician is able to gain understanding of the patient's knowledge base and be able to communicate directly the expectation that they take greater responsibility for their health. Prior to transition, it's important to identify an adult provider. Patients and caregivers may search on their own or seek recommendations from others, including their pediatric provider. I would recommend identifying a provider 1 to 2 years prior to the transition. It's also important to choose a provider who specializes in headache medicine. However, given the shortage of providers in the field, that may not be practical. Not every doctor or neurologist specializes in headache medicine. However, through the expansion of telemedicine and partnering with colleagues who are willing to help care for patients with recurrent headaches. My hope is that every patient is able to gain access to the best care. For those going to college, identifying where they want their care to occur is important. College students may request to have their physicians and healthcare remain at home where their families live instead of where they go to school. For those moving a long distance away, identifying a specialist close to school early can avoid disruption and headache management. Follow-up visits can be done remotely via telemedicine, regardless of location. Now I'm going to move on to patient education. What I'm talking about is basic understanding of the healthcare system, including how medical coverage with insurance works, especially should there be a change in coverage, which could hinder the process of health maintenance. There needs to be an understanding of their health insurance and the potential limitations on choosing a provider. The provider should provide documentations, handouts at an age-appropriate reading level, summarizing key points to the patient and caregiver in regards to their diagnosis. Since we know that many children continue to have migraine into adulthood, efforts should be made to ensure patients receive the appropriate information for successful transfer of care. Transition readiness involves a yearly assessment by the provider that should include information on the medical condition, medications, understanding the side effects, identifying significant signs and symptoms, and assessing psychological health. There was an article in the Neurology Journal that was published in 2016 that documented guidelines on the transition of pediatric to adult healthcare in patients with neurological conditions. And the consensus, this was endorsed by the American Academy of Neurology and Child Neurology Society. The Transition Readiness Assessment Questionnaire, also known as TRACK, is considered the best validated transition readiness tool and has been widely used to help providers identify the areas to address where a patient may not feel ready to transition. This questionnaire has 5 different categories, and it is available online to download. The categories are managing medications, appointment keeping, tracking health issues, talking with providers, and managing daily activities. It's important that the patient fills this out, not the parents. What we're interested in is whether or not the patient is ready to take that next step towards transition of care. And it can also identify areas of weaknesses that need to be worked on before the transition happens. I would also mention that patients should start to feel more comfortable making phone calls to providers in the presence of a caregiver or parent and be able to advocate on their behalf. They should be able to schedule appointments and also discuss their condition with their provider. I'd also recommend a preliminary visit with an adult provider that can ease the stress and anxiety associated with transitioning or moving to a new provider. There are some known facts that we know about what could lead to poorer outcomes in regards to migraine care. Patients who are not prepared seem to have poor outcomes due to increased morbidity and worsening of their medical conditions. The factors that contribute to poor transition include a lack of preparation or resources targeting late adolescents, and the fact that many young adults feel unprepared to enter the adult healthcare environment. This is a major challenge to the transition process. Factors that contribute to successful transition include patients that are older at their last visit to the pediatric center, those with comorbid conditions. And the reason why is these patients are used to going to the doctor time and time again, and they're hearing a lot about their condition. So they're a little bit more comfortable with discussing their condition with a provider. Those with no history of substance abuse are also more successful in transitioning. Adherence to using preventive treatments and procedures, attending appointments without parents or siblings, living close to the medical facility, and having well-documented recommendations in the patient's chart. Surprisingly, successful transition was not related to age, gender, residence in a parent's home, family income, or education. Studies do suggest discussions with patients, families, and providers should start as early as about 13. This allows for both patient and caregiver to understand all that is required for transition. At the age of 14, a transition packet should be developed with the collaboration of the patient, caregivers, and healthcare professional. The transfer packet should include the following: the headache history, the diagnosis, treatment plan, including failed medications, the length of medication trial, the emergency plan, comorbid disorders like anxiety and depression, and non-pharmacological headache treatments. An emergency plan in the form of an emergency department letter is also important in case a patient needs to seek emergent care at an outside facility while away from home or at college. There should also be a backup plan included in that emergency letter. A list of preferred medications should be summarized with specifics, on the dosing and frequency. The letter should also include a list of medications that should be avoided that could lead to rebound or worsening headache disorders. The packet can also be used for coordination of care and communication between providers. The transition packet should be updated regularly and modified annually with the patient's goals and preference. In summary, it's important to know that transition from adolescent to adult is critical, especially for those affected by migraine. And there are a variety of things to consider in this population for all parties involved. For instance, late adolescents may struggle with a variety of psychiatric comorbidities such as anxiety and depression, and that could influence treatment options and create opportunities to manage multiple conditions with less medication. That being said, the number of medication options will improve significantly as most medications for migraine have FDA approval for adults over the age of 18, particularly the newer medications that are out there. For adolescent individuals, the beginning of sexual activity, the onset of gynecological conditions, and the presence of irregular or painful menses may raise questions regarding the use of oral contraceptives to treat migraine. Given the risk of stroke in patients with migraine aura, it's also important to discuss substance abuse and smoking history, as the risk is vastly increased with patients that are using high estrogens, as well as those who smoke. Now, the relative risk for this young population is low. However, it's important for the provider to have these discussions and conversations with patients, and I find it helpful for adolescents to be more comfortable addressing these issues without their parents or caregiver present. So if you're asked to step out of the room, please don't get offended. We're just trying to do the best thing to take care of your child. Healthcare providers should document when any discussion is done regarding transfer of care. I'm thankful for this opportunity to speak to you today, and I also thank the American Migraine Foundation for this opportunity as well. Have a good evening.